NHA Medical Assistant Exam Prep. Question 1. When the provider plans an office-based excision, why should the assistant verify the signed consent before setup is completed? Option A. Confirms required authorization is present before the invasive procedure. Option B. Preserves organism viability that formalin would destroy. Option C. Prioritizes provider assessment and emergency response. Option D. Supplies a sharp blade designed for precise tissue cutting. The correct answer is option A. Confirms required authorization is present before the invasive procedure. Verify the signed consent before setup is completed because it confirms required authorization is present before the invasive procedure. Avoiding formalin when a specimen is intended for culture preserves organism viability that formalin would destroy. Reporting unexpected bleeding or patient instability immediately prioritizes provider assessment and emergency response, and recognizing a scalpel as a cutting instrument supplies a sharp blade designed for precise tissue cutting. Question 2. Why is recognizing a retractor as an exposing instrument appropriate when tissue edges obstruct the operative field? Option A. Preserves specimen identity before it leaves the room. Option B. Securely controls the curved needle during suturing. Option C. Holds tissue aside to improve visualization. Option D. Preserves organism viability that formalin would destroy. The correct answer is option C. Holds tissue aside to improve visualization. Recognize a retractor as an exposing instrument. This holds tissue aside to improve visualization. Labeling a biopsy specimen in the patient's presence preserves specimen identity before it leaves the room, while recognizing a needle holder as the instrument for driving a suture needle securely controls the curved needle during suturing. Avoiding formalin when a specimen is intended for culture preserves organism viability that formalin would destroy. Question 3. The provider documents technical safeguard during a HIPAA privacy and security review. Which description should the assistant recognize? Option A. Posting identifiable patient information on a public platform. Option B. Technology protecting electronic information and controlling access. Option C. Health information stripped of specified identifiers or determined to have very low re-identification risk. Option D. A permitted disclosure to authorized public health entities under applicable conditions. The correct answer is option B. Technology protecting electronic information and controlling access. Technical safeguard means technology protecting electronic information and controlling access. It includes authentication, encryption, and transmission security. Social media disclosure means posting identifiable patient information on a public platform. Identified information means health information stripped of specified identifiers or determined to have very low re-identification risk. Public health disclosure means a permitted disclosure to authorized public health entities under applicable conditions. Stressed about your NHA Medical Assistant Exam? We can take NHA Medical Assistant Exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. What is the main reason to protect a patient from injury during a seizure when a patient begins generalized convulsions in the examination room? Option A. Clears hazards and supports safety without restraining movements. Option B. Supports rapid evaluation for acute coronary syndrome. Option C. Prevents aspiration and permits treatment by trained emergency personnel. Option D. Improves cerebral perfusion and prevents a fall. The correct answer is option A. Clears hazards and supports safety without restraining movements. Protecting a patient from injury during a seizure clears hazards and supports safety without restraining movements. Treating chest pressure with diaphoresis as an emergency supports rapid evaluation for acute coronary syndrome, while activating emergency care for an unresponsive hypoglycemic patient prevents aspiration and permits treatment by trained emergency personnel. Laying a fainting patient supine improves cerebral perfusion and prevents a fall. Question 5. How does verifying electronic orders before specimen collection help when a laboratory order appears in the work queue? Option A. Prevents loss, unauthorized disclosure, and uncontrolled copies. Option B. Confirms patient, test, timing, and provider instructions. Option C, maintains record integrity and documents the correction. Option D, preserves the audit trail and shows when the information was added. The correct answer is option B, confirms patient, test, timing, and provider instructions. Verifying electronic orders before specimen collection confirms patient, test, timing, and provider instructions. Not storing patient data on unapproved personal devices prevents loss, unauthorized disclosure, and uncontrolled copies, while amending an error maintains record integrity and documents the correction. Using a late-entry process rather than backdating preserves the audit trail and shows when the information was added. Question 6. Which safety or quality benefit comes from assisting with a sterile procedure when trained when the provider performs minor surgery in the office? Option A, supports the procedure while maintaining technique and role boundaries. Option B, reserves diagnostic conclusions for licensed providers. Option C, reinforces instructions without creating an independent treatment plan. Option D, refers interpretation to an authorized clinician. The correct answer is option A, supports the procedure while maintaining technique and role boundaries. Assist with a sterile procedure when trained. It supports the procedure while maintaining technique and role boundaries. Not independently diagnosing a patient reserves diagnostic conclusions for licensed providers. Providing education from an approved care plan reinforces instructions without creating an independent treatment plan. And not independently interpreting an EKG refers interpretation to an authorized clinician. Question 7. Which option accurately defines edema in the area of medical terminology? Option A, a heart rate above the expected range. Option B, lying flat on the back with the face upward. Option C, abnormal accumulation of fluid in tissues. Option D, a blood glucose below the expected range. The correct answer is option C, abnormal accumulation of fluid in tissues. Edema refers to abnormal accumulation of fluid in tissues and produces swelling that may be localized or generalized. Tachycardia refers to a heart rate above the expected range. Supine refers to lying flat on the back with the face upward, and hypoglycemia refers to blood glucose below the expected range. Question 8. After recognizing that the patient finished drinking hot coffee just before vital signs, why should the assistant avoid an oral temperature immediately after a hot drink? Option A, prevents a falsely elevated oral temperature. Option B, identifies the expected location of the cardiac apex in most adults. Option C, provides the standard conversion needed for weight-based calculations. Option D, reduces the chance that the patient will consciously change the breathing pattern. The correct answer is option A, prevents a falsely elevated oral temperature. Avoiding an oral temperature immediately after a hot drink prevents a falsely elevated oral temperature. Locating the apical pulse at the fifth intercostal space near the left midclavicular line identifies the expected location of the cardiac apex in most adults. Converting pounds to kilograms by dividing by 2.2 provides the standard conversion needed for weight-based calculations, and counting respirations without announcing the observation prevents the patient from changing the breathing pattern. Are you looking for NHA Medical Assistant Exam actual questions? Visit our website pokerexams.com to access NHA Medical Assistant Exam Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get NHA Medical Assistant Exam answer key today. Question 9. In this situation, a patient disputes a diagnosis at the front desk. Why is moving a sensitive discussion to a private area appropriate? Option A, reduces uncertainty and allows the patient to make informed choices. Option B, reduces errors involving date, time, location, and preparation. Option C, protects confidentiality and reduces embarrassment. Option D, gets the issue to someone able to decide. The correct answer is option C, protects confidentiality and reduces embarrassment. Moving a sensitive discussion to a private area protects confidentiality and reduces embarrassment. Acknowledging an unexpected delay reduces uncertainty and allows the patient to make informed choices, while confirming scheduling details at the end of the call reduces errors involving date, time, location, and preparation. Escalating unresolved complaints through the chain of command gets the issue to someone able to decide. Question 10. Which result is expected from reconciling daily receipts and deposits when the office closes after collecting co-payments? Option A. Promotes fairness while allowing authorized escalation when needed. Option B. Identifies discrepancies and supports accurate financial controls. Option C. Reduces shortages while avoiding unnecessary overstock and expiration. Option D. Reduces misdirected protected information. The correct answer is option B. Identifies discrepancies and supports accurate financial controls. Reconcile daily receipts and deposits. This identifies discrepancies and supports accurate financial controls. Following written office policies consistently promotes fairness while allowing authorized escalation when needed. Maintaining an inventory par level reduces shortages while avoiding unnecessary overstock and expiration. And using approved fax cover sheets and verified numbers reduces misdirected protected information. Question 11. When a laboratory test is scheduled for the next morning, why should the assistant review fasting requirements in specific terms? Option A. Lowers infection risk and supports healing. Option B. Prevents accidental intake that could invalidate results. Option C. Supports informed decisions and appropriate post-vaccine monitoring. Option D. Reduces overload and supports retention. The correct answer is option B. Prevents accidental intake that could invalidate results. Review fasting requirements in specific terms. This prevents accidental intake that could invalidate results. Reviewing wound-care hand hygiene and dressing technique lowers infection risk and supports healing. Explaining vaccine benefits and expected reactions supports informed decisions and appropriate post-vaccine monitoring. And presenting information in small organized steps reduces overload and supports retention. Question 12. Why is maintaining required credentials and continuing education appropriate when certification renewal is approaching? Option A. Demonstrates ongoing competence and compliance. Option B. Reserves diagnostic conclusions for licensed providers. Option C. Preserves authorship and legal accountability. Option D. Performs venipuncture within competence and applicable law. The correct answer is option A. Demonstrates ongoing competence and compliance. Maintain required credentials and continuing education. It demonstrates ongoing competence and compliance. Not independently diagnosing a patient reserves diagnostic conclusions for licensed providers. Not signing the provider's name preserves authorship and legal accountability. And collecting blood specimens when trained and authorized performs venipuncture within competence and applicable law. Question 13. Which outcome supports activating the safety device immediately after injection when the needle has been withdrawn from the patient? Option A. Uses a well-developed thigh muscle away from major nerves and vessels. Option B. Reduces bruising and tissue trauma. Option C. Isolates the sharp and reduces accidental exposure. Option D. Confirms deposition within the superficial dermal layer. The correct answer is option C. Isolates the sharp and reduces accidental exposure. Activating the safety device immediately after injection isolates the sharp and reduces accidental exposure. Using the vastus lateralis for an infant intramuscular injection uses a well-developed thigh muscle away from major nerves and vessels. Not massaging a heparin injection site reduces bruising and tissue trauma. And creating a small wheal for a correctly placed intradermal test confirms deposition within the superficial dermal layer. Question 14. What is the main reason to report increasing redness, warmth, swelling, pain, or purulent drainage when the wound appearance has worsened since the last visit? Option A. Prevents redepositing microorganisms onto clean tissue. Option B. Supports continuity by recording measurements, drainage, materials, and response. Option C. Reduces tension on the abdominal incision. Option D. Identifies findings that may indicate infection or complication. The correct answer is option D. Identifies findings that may indicate infection or complication. Reporting increasing redness, warmth, swelling, pain, or purulent drainage identifies findings that may indicate infection or complication. Using a new swab or gauze for each cleansing stroke prevents redepositing microorganisms onto clean tissue. Documenting the wound, care performed, and patient tolerance supports continuity by recording measurements, drainage, materials, and response, and positioning an evisceration patient with knees flexed if tolerated reduces tension on the abdominal incision. Question 15. How does reporting critical values according to policy help when a result meets the laboratory's critical threshold? Option A. Creates a traceable record that the problem was identified and resolved. Option B. Prevents runover between pads and distorted reactions. Option C. Prevents ambiguity and supports clinical interpretation. Option D. Ensures rapid provider notification and patient follow-up. The correct answer is option D. Ensures rapid provider notification and patient follow-up. Report critical values according to policy. This ensures rapid provider notification and patient follow-up. Documenting corrective action before resuming testing documents that the problem was identified and resolved. Removing excess urine from a reagent strip as directed prevents runover between pads and distorted reactions, and recording results with units and reference information prevents ambiguity and supports clinical interpretation. Question 16. Which safety or quality benefit comes from keeping sterile items above waist level and within view when the assistant is maintaining a sterile field? Option A. Recognizes an area that cannot be reliably maintained as sterile. Option B. Limits spread through masking, tissues, hand hygiene, and spatial separation. Option C. Reduces unnoticed contamination and preserves control of the field. Option D. Blocks larger respiratory droplets at close range. The correct answer is option C. Reduces unnoticed contamination and preserves control of the field. Keeping sterile items above waist level and within view reduces unnoticed contamination and preserves control of the field. Considering the outer 1-inch border of a sterile field contaminated recognizes an area that cannot be reliably maintained as sterile. Following respiratory hygiene and cough etiquette limits spread through masking, tissues, hand hygiene, and spatial separation, and using a surgical mask for droplet precautions as directed blocks larger respiratory droplets at close range. Question 17. A record related to insurance fundamentals includes prior authorization. Which interpretation is appropriate? Option A. Payer approval required before certain services or medications. Option B. The request submitted to a payer for reimbursement. Option C. The payer statement showing how a claim was processed. Option D. A clinician or facility without the plan's network contract. The correct answer is option A. Payer approval required before certain services or medications. Prior authorization is payer approval required before certain services or medications. It confirms coverage criteria but does not guarantee final payment. Claim is the request submitted to a payer for reimbursement, while explanation of benefits is the payer statement showing how a claim was processed, and out- network provider is a clinician or facility without the plan's network contract. Question 18. In medical law and ethics exam preparation, abandonment appears as a key term. Which meaning is correct? Option A. A legal command to appear, testify, or produce records. Option B. The ethical duty to avoid causing harm. Option C. A minor legally treated as an adult for relevant decisions. Option D. Improper termination of a provider-patient relationship without reasonable notice or continuity. The correct answer is option D. Improper termination of a provider-patient relationship without reasonable notice or continuity. Abandonment describes improper termination of a provider-patient relationship without reasonable notice or continuity. It may leave the patient without needed care. Subpoena describes a legal command to appear, testify, or produce records. Non-maleficence describes the ethical duty to avoid causing harm. Emancipated minor describes a minor legally treated as an adult for relevant decisions.
Stressed about your NHA CCMA exam? We can take NHA CCMA exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. In this situation, the hold lasts longer than expected. Why is returning to a caller placed on hold within a reasonable time appropriate? Option A gives an update and offers voicemail or a callback. Option B provides consistent information without arguing. Option C shifts immediately from routine service to emergency protocol. Option D improves service quality and clinical safety. The correct answer is option A, gives an update and offers voicemail or a callback. Returning to a caller placed on hold within a reasonable time gives an update and offers voicemail or a callback. Explaining office policy clearly and respectfully provides consistent information without arguing. Recognizing emergency statements during service calls shifts immediately from routine service to emergency protocol. And arranging language assistance without judgment improves service quality and clinical safety. Question 20. During basic pharmacology review, the assistant encounters oral hypoglycemic. What does this term mean? Option A. A medication used to promote bowel movement. Option B. A medication used to lower elevated blood pressure. Option C. A medication used to treat susceptible bacterial infections. Option D. A non-insulin medication used to improve glucose control. The correct answer is option D. A non-insulin medication used to improve glucose control. Oral hypoglycemic is a non-insulin medication used to improve glucose control. It lowers blood glucose through mechanisms such as improved sensitivity or reduced production. Laxative is a medication used to promote bowel movement, while antihypertensive is a medication used to lower elevated blood pressure and antibiotic is a medication used to treat susceptible bacterial infections. Question 21. In CLIA and laboratory quality exam preparation, individualized quality control plan appears as a key term. Which meaning is correct? Option A. The laboratory category with the most demanding personnel and quality requirements. Option B. An outside laboratory receiving specimens for testing. Option C. The final record of a laboratory result with appropriate identifiers and units. Option D. A risk-based quality approach permitted for eligible non-wave test systems. The correct answer is option D. A risk-based quality approach permitted for eligible non-wave test systems. Individualized quality control plan describes a risk-based quality approach permitted for eligible non-wave test systems. It combines risk assessment, a quality control plan, and ongoing quality assessment. High-complexity test describes the laboratory category with the most demanding personnel and quality requirements. Referral laboratory describes an outside laboratory receiving specimens for testing. Patient test report describes the final record of a laboratory result with appropriate identifiers and units. Question 22. AHIPAA Privacy and Security Study Note highlights accounting of disclosures. Which definition matches? Option A. Policies and management processes for security. Option B. A record of certain disclosures available to the patient on request. Option C. The patient's request to add or correct information in the record. Option D. An impermissible use or disclosure that compromises privacy or security. The correct answer is option B. A record of certain disclosures available to the patient on request. Accounting of disclosures means a record of certain disclosures available to the patient on request. It does not include every routine treatment, payment, or operations use. Administrative safeguard means policies and management processes for security. Request for amendment means the patient's request to add or correct information in the record. Breach means an impermissible use or disclosure that compromises privacy or security. Question 23. Which outcome supports confirming receipt of critical information by the receiving party when an urgent report is faxed to another office? Option A. Supports autonomy rather than directing the patient without input. Option B. Supports continuity and early review of recovery. Option C. Closes the communication loop and reduces loss of time - sensitive data. Option D. Prevents an incomplete visit and duplicate testing. The correct answer is option C. Closes the communication loop and reduces loss of time - sensitive data. Confirm receipt of critical information by the receiving party. It closes the communication loop and reduces loss of time - sensitive data. Respecting patient choice when discussing resources supports autonomy rather than directing the patient without input. Scheduling follow-up within the recommended interval supports continuity and early review of recovery, and coordinating laboratory testing before a specialist visit prevents an incomplete visit and duplicate testing. Question 24. What is the main reason to use two identifiers before giving medication when the assistant enters the room with a prepared dose? Option A. Preserves autonomy while ensuring the care team addresses the refusal. Option B. Separates medication work from contaminated materials. Option C. Prevents guessing when the prescriber must resolve uncertainty. Option D. Prevents medication from being given to the wrong patient. The correct answer is option D. Prevents medication from being given to the wrong patient. Use two identifiers before giving medication because it prevents medication from being given to the wrong patient. Respecting a competent patient's refusal preserves autonomy while ensuring the care team addresses the refusal. Preparing medication in a designated clean area separates medication work from contaminated materials, and clarifying an order that is illegible or ambiguous prevents guessing when the prescriber must resolve uncertainty. Question 25. During basic pharmacology review, the assistant encounters Schedule II controlled substance. What does this term mean? Option A. A medication that reduces formation or extension of blood clots. Option B. A drug category with accepted medical use and high misuse potential. Option C. A biological product that stimulates protective immune memory. Option D. A medication used to decrease diarrhea. The correct answer is option B. A drug category with accepted medical use and high misuse potential. Schedule II controlled substance is a drug category with accepted medical use and high misuse potential. It requires strict prescribing, storage, and record-keeping controls. Anticoagulant is a medication that reduces formation or extension of blood clots, while vaccine is a biological product that stimulates protective immune memory, and antidiarrheal is a medication used to decrease diarrhea.